Hello there. I am Joseph Grice. I'm the Chief Value Officer here at the Community Health Center Association of Mississippi. Today I have with me Dr. Reza Sanai with Picasso MD. Reza, I'll give you a chance to really briefly just give a quick introduction, and then we'll get into some questions.
Sure. Yeah, Reza Sanai, I'm a cardiologist by training and co-founder of Picasso MD. So we work with rural and underserved communities to help providers access specialists in more timely fashion. So we've been working together with Community Health Center now for nearly 4 years now. So been a great partnership and appreciate the time to connect.
All right, thank you. So first question is, when you think about the future of health centers, what opportunities or challenges do you believe that we must address today to ensure stronger, healthier communities tomorrow?
Yeah, I think at least from my experience with the Community Health Center here, as well as in other areas, I think maximizing the capabilities of the community health centers and keeping care centralized within the FQ community is probably the most important thing that I've seen. If you send patients out, there's risks associated with that, and for patients, having a centralized access point where you can kind of really maximize your daily care needs, I think is probably the most important strategy any FQ could have to maintaining viability.
Yeah, I think that's accurate. I think FQHCs is kind of the core of what they're built for. So, in what ways has your experience with health centers, has your connection been deepened to shape the community and to build roots in how to prepare for the future?
Yeah, I think when you are a platform like ourselves, the ultimate success really is on grassroots efforts and getting connected at the atomic unit, at the provider level, leadership level. So these kind of presentations, abilities to kind of meet and actually create real relationships is the core of any successful outcome. Otherwise, it's just hyperbole. So this is like the most important thing that we can do to kind of establish relationships and ultimately work as a collaborative to make some positive impact.
Great. So specifically about this conference, our annual conference here, what do you think are some valuable lessons or insights that health center staff and other stakeholders are able to take away?
Yeah, I think for everyone has their own, there are macro problems that probably apply to all of the 2021 organizations that are part of the Community Health Center, but sitting down and actually actively listening to specific pain points that each organization may have. These are individual practices that have individual needs. So, times like this, being able to sit down and actually listen thoughtfully and go over this in a non-pressure way without a camera or computer screen in between you is kind of allows you to get to the crux of the problems a lot easier somehow than doing things virtually. So I think this is like critical to be able to get together and work collaboratively in that fashion.
Yeah, so sort of a part two of that question, how do you think the conference does as a platform to build and strengthen connections with other health professionals and with other organizations, just the networking opportunities and the like?
Yeah, I think from what I've seen since we've been working together, it's a really powerful blend of looking for outside resources, leveraging them, empowering them, and then creating a collaborative, both from the organizational level here as well as with other great services that you kind of highlight, and then giving them opportunities to share, learnings as well as opportunities. That open forum is critical to creating a partnership. You can't do it alone. If you figured everything else out, I don't think there'll be a need for any of us here. But the goal, and if we had figured it out, we wouldn't be part of this work. So it's that creating a safe environment for collaboration, which I think has been incredible. So kudos to you and the team.
Yeah, well, I appreciate it. That's great. Thanks for your time, and thanks for all that you do for the Community Health Center movement.
Appreciate it. Thank you very much.
All right.
Thank you. Bye-bye.